Hi, in this video we are going to look at the cortico-spinal tract. Cortico means cortex, spinal, the spinal cord. So it's coming from the cortex down to the spinal cord. That makes it a descending tract. And the fibers in it is the motor fibers. And they're concerned with movement. Now, what kind of movement are they concerned? The voluntary, discrete, skilled movement of especially the distal part of the limbs. So this system, it sends the fiber down to the spinal cord and then to the muscles. Now, here is a homunculus on the cortex. Now, different part of the cortex controls the different part of the body. Now, the face here, and then the arm, the trunk, and the limbs. And now, if we look at the fibers, these fibers from the cortex, 1/3 of the fibers are from the primary motor cortex, 1/3 from the secondary motor cortex, and 1/3 from the parietal lobe, 2/3 from the precentral gyrus, and 1/3 from the postcentral gyrus. These fibers, they will converge together and they will reach the posterior limb of internal capsule here. And then they will pass through the posterior limb of internal capsule, the different fibers from the cortex, right? Here as well, from this side. Now, these fibers will go down to the midbrain. And in the midbrain, they will pass through the middle 3/5 of the basis pedunculi of the midbrain. Now, here is the peduncles of the midbrain here. And these peduncles are connecting the brainstem to the cerebral hemispheres. So, which is called the crest cerebri. Now, these fibers here, let's say this is the basis of pedunculi, and through the middle 3/5, it will go down and reach, and here it will pass down and it will reach the pons as a cortico-spinal tract coming down, okay? It will reach the pons. Now, here is the pons. Now, they reach the pons as a bundle, as a tract. Now, in the pons, there are nuclei, which are called the pontine nuclei. Now, here are a lot of pontine nuclei, which are the gray matter. And these nuclei send the fibers to the cerebellum, the pontocerebellar tract, or the fibers, right? And now, when the corticospinal tract reaches the pons, these nuclei and fibers are in their way. So, this tract will break down into different fibers and pass through the spaces between these nuclei and fibers. And when they reaches the medulla oblongata, they will converge together again to make the corticospinal tract or a bundle. Now, this bundle will pass through medulla. In the medulla, when they pass as a big bundle, they will make a swelling in medulla, which is called the pyramids. So here, when they pass down through the medulla, they make a swelling here. Now, that's why this tract or these tracts are also called the pyramidal tracts, because they make the pyramids in medulla when they're passing down, right? Here are the pyramids. Okay, so they make a swelling on medulla called the pyramids. And now, at the lower part of the medulla, most of the fibers, they will decussate. They will cross from the left to right and from the right to left. But some fibers will not cross. They will go ipsilateral. They will go down ipsilateral here. So here, these are the fibers that will make the ventral or interior corticospinal tract, and the fibers that crossed will make the lateral corticospinal tract. So here is the lateral corticospinal tract. And here is the ventral or the interior corticospinal tract. Now, these fibers will go down. Now, this is the lateral corticospinal tract coming here, and it's on the lateral side of the white column, okay? And here, right? And these fibers, the lateral corticospinal tract fibers, will go down throughout the spinal cord and give the branches to the interior or the ventral gray column in the spinal cord. And here is the ventral or interior corticospinal tract. Now, the ventral corticospinal tract, it did not cross at the medulla, but it will cross here at the spinal level when it gives the branches off, and it will give the branch to the ventral or interior gray column here, spinal cord. And the fibers of the ventral corticospinal tract will terminate in cervical regions or upper thoracic region, and they will not go throughout the spinal cord. Or the lateral corticospinal fibers, they will give the branches to the ventral gray column, and most of the large fibers, the largest, will only stimulate directly the motor neurons. Right here, the motor neurons are stimulated by the largest fibers, and most of the smallest fibers of the corticospinal tract will, through internential neurons, it will stimulate alpha and some gamma neurons, which will in turn stimulate the rest of the neurons, like the motor. So this is the corticospinal tract and the different fibers. Now, if we look at the cortex, and it controls the different part of the body. Let's imagine this from here, the fibers coming down here through the spinal cord, and they will go to the bicep muscle, right? Now, if there is a lesion in this part of the cortex, your bicep will be paralyzed and it won't work, and you won't be able to perform any activity with the bicep. But on the contralateral side, okay, not on the ipsilateral, because the fiber cross, okay? So if we look at the different branches that the corticospinal tract gives before it reaches the spinal cord, so here, let's say these neurons, they are going to stimulate the bicep muscle. When they're going down, they give off branches to inhibit the surrounding or adjacent neurons or the cortical area. So here, they're inhibiting these areas. And when they're going down, they give the branches to other nuclei, like lentiform nucleus of the basal ganglia here, the lentiform nuclei. Then when it's going down, it also gives the branch to the red nucleus, and it crosses at medulla, lower part of medulla, and it goes down to the spinal cord, right? So this is the corticospinal tract. And here's the red nucleus. It will give a branch to the red nucleus. And here is the vestibular nucleus, and it will give a branch to the vestibular nucleus. It will give a branch to the olivary nucleus, and it will also give a branch, here's the olivary nucleus, and it will also give a branch to the reticular formation here, up here. So the reticular formation. This is as if the cerebral cortex is informing all these nuclei of whatever intended action it has. Now, it's very important that these nuclei are being informed, because if they are busy with other activities or tasks, your muscles cannot be in coordination, right? And it will be a disaster. So the cortex informs these nuclei of what the cortex is going to do. So it's very important to inform these nuclei, so these nuclei can inhibit other muscles and let the activity be performed by the muscles the cortex intend to stimulate. So this is all about the corticospinal tract.